Today we'll take on the infamous Rancho Los Amigos scale, also known as the Rancho scale. We'll break it down, talk about some key characteristics of each level, plus we'll summarize these levels visually and talk about some tips that might make memorizing the scale a little easier. Please don't forget to like, comment, share, and subscribe if you find this content helpful. Welcome to the OT Minute. My name is Arno. The Rancho Los Amigos scale is a go-to scale for classifying the level of cognitive impairment of an individual after they've experienced a TBI or a traumatic brain injury. It's integral in helping various disciplines and healthcare professionals effectively communicate the level of impairment. The Rancho scale originally had 8 levels and was then later revised to include 10 levels to better describe the higher levels of brain recovery. Level 1 indicates the most severe cognitive impairment, which is a person in a coma who is completely unresponsive to external stimuli. And 10 indicates the best recovery outcome, which is a person's return to purposeful and appropriate behaviors and function. The Rancho scale is a descriptive scale that uses several cognitive and behavioral indicators to best rate a person's recovery. Now, it is possible for a person to kind of fluctuate between more than one of these levels, especially when they're progressing between levels, so the therapist will have to select the level that best describes the patient. Let's break these down one by one. As we stated before, level 1 indicates a person who does not respond to any stimuli and remains in a coma state. This level is called the no response level, and a person would require total assistance. From a memorization and recall standpoint, this is a pretty straightforward level since it is what it sounds like. A person doesn't respond in any observable way to any stimulus. Level 2 is called the general response level, and a person at this level would be considered to require total assistance as well. But in this level, a person might begin to respond to external stimuli such as a painful prick or a voice, but their response would be non-purposeful and inconsistent. Not only that, their response may also be the same regardless of the stimulus, and their response might be delayed. For example, they may groan in response to a painful prick or the sound of a familiar voice. However, they won't turn to the familiar voice or they won't move their hand or a limb. So the response is a general response without any specificity to the actual stimulus. Level 3 is called the localized response level, and an individual at this level would still require total assistance. They would still respond inconsistently to stimuli, but now the responses are more directly related to the stimulus. For example, if a patient's hand is pinched or pricked, he may withdraw the hand or limb that is being pricked, indicating a response that is specifically related to the painful stimulus that they experience instead of a more generalized response. At this level, individuals may also respond more to familiar people such as family or friends instead of medical staff, so utilizing and incorporating family during therapy sessions may be helpful to increase patient responses. Since the patient is limited in their cognition and voluntary movement responses during levels 1 through 3, these would be levels where sensory stimulation and sensory strategies is often utilized and helpful to stimulate the brain and help the patient increase their level of alertness in order to progress cognitively and ultimately functionally, which is what we're all about. Next, we have level 4, which is an important level, and I think it's an easy one to remember because this is called the confused and agitated level. At this level, a person is becoming more alert. However, the reason this level stands out is that personally, I think it's a stage that can be really scary and confusing for family members because in this level, a patient is more alert, but they are significantly confused and disoriented, and their behaviors are very unpredictable at times. The scale refers to this as a hyperactive state with bizarre and non-purposeful behavior. In this stage, patients often exhibit agitated behavior, so patient safety and safety of others is super important. For example, a person at this stage may become agitated during a transfer in an attempt to bite a therapist or family member or try to pull out their tubes or lines. Therefore, extra care should be taken to prevent agitation, and sensory strategies such as limiting sensory input and modifying activity demands to provide a supportive environment for the patient during therapy sessions is really important. So it kind of comes back to the importance of finding that just right fit where you're trying to engage them in some small ways towards purposeful actions, but also understanding they have a decreased frustration tolerance, as well as just a general disorientation. It's important also to note that the scale indicates that the agitation on this level seems to be more from an internal confusion and not an external confusion, meaning that agitation may not have external or environmental triggers. It may be more from their general state of confusion and disorientation. At level 4, individual short-term memory is also non-existent, so new learning can't happen Due to all of these factors, patients at level 4 will require maximal assistance overall. Let's move now to level 5, which is called the confused, inappropriate, and non-agitated level. A person at this stage would still require maximal assistance. However, in this level, a person would be more consistent in following and responding to simple commands. Notice the word simple. These are one-step commands that are short and familiar. The person's behavior may still seem a bit strange and inappropriate, and their speech may be confabulated due to memory gaps and confusion. A person can also do simple tasks, but won't generally initiate tasks without prompting or guidance from someone else. They are not oriented yet to person, place, and time, and may wander aimlessly at this stage, so they need to be monitored for safety. New learning is also still inhibited because of a lack of short-term memory. They may experience episodes of agitation, but the agitation will generally be specific to unpleasant external stimuli. For example, they may become agitated because of loud music or bright lights in the rehab gym. Therefore, we can target those specific environmental factors, and it should decrease their agitation. At level 5, repetitive and simple components of ADL tasks might be something you would want to consider incorporating into treatments. This can give them that just right challenge to where they are having to sequence or begin to sequence steps together to complete a whole task, which is taking us to level 6 on the Rancho scale. This is called the confused appropriate level. At this level, an individual would generally require moderate assistance. At this point, they should be able to follow simple commands consistently and should be able to remember and do familiar tasks. New learning still is not really happening at this level, and they still have memory deficits. However, old learning such as relearning ADLs can happen at this level with supervision, which indicates some really good progress functionally. To help them relearn old tasks, it's helpful to note that their attention is improving and they can attend to familiar tasks in a quiet and distraction-free environment for up to 30 minutes with moderate verbal cueing or redirection. At this level, safety would still remain a big concern because a person may overestimate their abilities because they aren't really aware of their limitations. They will, however, show more self-awareness in the sense that they're aware of the situation in a broad sense and they are more in tune with their environment. For example, they may now be more oriented to the hospital that they're in and who the people are who are coming in to see them and help them. They'll also probably remember why they are where they are and where they are, such as what hospital they're in and so forth. However, their orientation to person, place, and time might still be inconsistent. At this level, simple tasks such as making a sandwich or folding clothes might be appropriate for the patient to perform so that they can work on some of those cognitive skills. Next up is level 7. Here we enter a new phase called the automatic appropriate level. This is a significant marker because around this point, a person would require minimal assistance for daily living skills. They would be oriented to familiar settings and they should be able to do their daily routine, including self-care, with little to no confusion. These familiar tasks can sometimes be done in a very automatic way, which can look a little robotic at times. The biggest thing about this level that sticks out in my head is that new learning can begin to happen here. Memory is improving, which is allowing for improved carryover. This would naturally be very significant for rehabilitation purposes and therapy because a person who suffered a severe TBI will likely also continue life with some modifications and adjustments that require that they learn new skills. At level 7, they will be able to better learn new skills that they may now need. For example, now they'll be able to learn maybe new adaptive devices with more independence. New learning may still take a long time and their attention is not great, so repetition will be important. Their attention at this level can be up to 30 minutes, similar to level 6, but now they only need minimal redirection. At this level, simple community reintegration tasks might be appropriate to work into treatments because of their improved memory and improved learning. However, grading activities and choosing the appropriate environment will continue to be important to promote a patient's success. Keep in mind, at this level, an individual still tends to overestimate their abilities, so safety continues to be an important focus during treatment. Level 8 is called the purposeful appropriate level. At this stage, individuals generally require standby assistance. At this point, the individual is oriented to who they are, who others around them are, as well as place and time. They thrive in a non-distracting environment environment, and they can have significant independence in those non-distracting environments. For example, a person at level 8 should be able to function relatively well cognitively at home, but may have some difficulty when out and about in a noisy or busy environment with multiple demands such as work environments. They can now attend to familiar tasks for up to 1 hour independently, and they can implement new skills and activities fairly independently once they're learned. At level 8, they are increasing in their self-awareness and their awareness of their performance. They begin to be aware of specific ways in which their impairments interfere with daily performance and tasks. However, they still need standby assistance to assist with safety and the occasional complex problem solving that might be needed as they encounter challenges. At this point, they will have learned how to effectively use assistive memory devices to recall their daily schedule. Their social emotional awareness is growing. They can acknowledge others' emotions and respond appropriately most of the time with minimal assistance. Their memory will also be better, but they may experience some depression and irritability. Therefore, finding the just right challenge in therapy will continue to be important in order to challenge and promote new learning and independence, but do it in a way that's appropriate for the person and doesn't overwhelm them and gives them a chance to be successful. At this point, community reintegration tasks can be utilized to continue to improve problem solving, social interaction, and many of the other necessary skills for independence. Level 9 is called purposeful appropriate with standby assistance on request. A person at this level is very independent and can shift between tasks, but may not always anticipate problems or obstacles. They are able to think about the consequences of their actions, and they can weigh their options with some assistance. They continue to see growth in their social emotional awareness and can acknowledge the emotional needs of others with standby assistance instead of minimal assistance like in level 8. Depression and low frustration thresholds may still be a part of the person's life, especially with added demands and stressors. At this level, their attention can be up to a minimum of 2 hours at a time, so that is a significant amount of attention. Again, that contributes to improved learning and new learning. Finally, we've got level 10 in the Rancho Los Amigos scale. This level is also called the purposeful appropriate level, but in this case, the person has increased their level of independence and is considered modified independent. This is the highest level of consciousness for the scale. At this level, a person can multitask in various environments, including new and more stressful environments. Think about work, parenting, and being a student, and just how demanding those occupations can be. A person at this level will now be modified and independent with these things. They may need extra time and some adaptive ways to do things, but at this point, a person would be able to fully take charge of their own learning and memory strategies. Their self-awareness is really good. They're aware of what their skills and their abilities are and where maybe some of their shortcomings are, and they adjust their performance and interactions with the demands in their life independently. However, they still may experience periods of depression and low frustration thresholds under stress. All right, we made it through all 10 levels. Let's go ahead, summarize this visually, and talk about memorizing the scale. When it comes to the Rancho scale, I like to break the 10 levels into 4 groups. The first group would be the response levels. So this would be levels 1 through 3. Next, we have the confused levels, which is levels 4 through 6. And then there's the automatic level, which is level 7. And then you have another string of 3 levels, which is the purposeful appropriate levels. Now for the response levels, it's helpful to remember that a patient at all of these levels will require total assistance. So level 1 again is the no response level, which is straightforward. No response to any external stimuli. Next, we've got the general response level. Here a person's responses are kind of like a reflexive response to per se like a painful stimuli. And again, they can also be very delayed. So those are the 2 kind of words that I associate with this level, reflexive and delayed. And this little picture here is just a man getting poked, but not acting towards the painful stimulus. Next, we have level 3, which is the localized response level. Here, the person might turn towards an auditory stimulus. They may blink when a bright light crosses their visual field. So at this level, they're responding to a specific stimulus. And that's why I have this picture here where you can see the person has a headache and they're reaching up to their head. So they're able to localize where the pain is and act towards that pain. So think more refined responses at this level. All right, moving right along, we've got our second group here, the confused group. Level 4 is the confused agitated. You're getting an increased level of alertness. Now that they're starting to do a little bit more purposeful movements. For example, now they might be pulling at tubes, participate in some really limited ways in maybe ADLs or familiar activities. So this would be a person who generally needs maximal assistance. Their attention is maybe a few seconds. So those are the things that I'm trying to make note of here. And then the big thing is what the name suggests is that they are agitated at this level. They're in a general state of confusion, up and down in their emotions, including potentially some really aggressive behavior. Now in level 5, it's called the confused, inappropriate, non-agitated. Here again, they need maximal assistance. And the two pictures that I like to associate with this level is kind of this picture of somebody brushing their hair with a toothbrush. So there's inappropriate use of items at this level. And then also this is a stage where they can wander about. Again, remember, so they're not oriented to person, place, and time at this point. Their attention is still really, really short. They don't have problem solving, and they may verbalize or talk about events in an inappropriate and confabulated way, meaning their behavior and responses are a mismatch for their environment. Once we get to level 6, I start to include a little bit more detail because level 6 and level 7, at least in my estimation, tends to be a little bit harder to start to differentiate. At this point, more and more things are starting to re-emerge. So here, their level of assistance required to complete tasks in general becomes moderate assistance. Their attention is about 30 minutes for familiar activities in environments that don't have distractions. Now their attention is 30 minutes, but they still require moderate assistance. So you want to remember that's going to be a key difference between level 6 and level 7. They follow simple commands consistently at this point, so you can kind of work your way backwards. So at level 5, they follow simple commands somewhat consistently, while at level 6, simple commands become much more consistent. Old learning can happen with supervision, and their orientation is still inconsistent. I've got this picture of this person brushing their teeth, because when I think about level 6, I think about the person who now is able to attend to their ADLs. They're able to complete them with moderate assistance, and they're able to relearn some of their old tasks, such as their ADLs at this level. Next, we move to level 7. This is a huge level. Functionally, they require now minimal assistance, which indicates a good increase in functional capabilities. Their attention is still 30 minutes roughly. However, now they only require minimal redirection or cueing or assistance to maintain that attention. So imagine you're working with a patient. If they only require minimal cueing, that's going to help them be much more efficient in their ADLs. They're going to still have shallow recall at this time, but the fact that they have shallow recall is allowing for some new learning to happen. So that's a big difference between level 6 and level 7. So you can split these two levels by asking the question, is this person learning new skills? If the answer is yes, then they're going to be probably at level 7 or higher. If they're not there yet, then they're going to be level 6 or lower on the Rancho scale. Another helpful picture to associate with level 7 is this robotic person, because sometimes their movements are considered or described to be a little bit robotic or automated. Safety awareness is decreased. Their problem solving is still not great here. However, there is a little bit of social awareness that's starting to emerge, but in general, they tend to be egocentric. They are oriented to person and place consistently, but their orientation to time is inconsistent. Now we've got our fourth group, the purposeful appropriate level here. At level 8, a person has now progressed to standby assistance. You'll see them improve in all of the areas that we talked about before. Their attention is going to be 1 hour, and now it's even in a distracting environment. So that's going to be really important, particularly if you start to think about how are they going to function when they're outside of their home. Short-term memory is also improving significantly at this point. All in all, this leads obviously to greater independence, greater performance, and a couple things that you may want to keep in mind is that their situational awareness is improving. They can think about the consequences of a decision or an action. They can now acknowledge others' needs and feelings. So before, where it was just emerging, now it's taken more of a full form, but they may still be argumentative, self-centered, irritable, and depressed. All right, next we've got level 9. Most of the OT board exam study guides that I've seen stop after 8 and don't really address levels 9 and 10, so I won't spend too much time. The fact that all of these areas, whether it's self-awareness, attention, recall, learning, problem solving, all of these things just continue continue to progress. So really the main things to remember about level 9, at least that I memorized, is the fact that now it's standby upon request. So it's even a greater level of independence. The ability to request assistance or to be independent enough to be rated at like a standby upon request level means that they need to have good self-awareness. At this level, they might also be getting back into the swing of work and driving and a lot of the higher level cognitive tasks that they maybe used to do, or they're learning new tasks. And I've got the person here holding her head in her hands to remind us that at this point, a person may be depressed. They have low frustration tolerance potentially. We are seeing that improve as we go into level 10. In level 10, they get to the point where they're modified independent, meaning they are independent. They can manage their strategies for coping with frustration or depression or functional limitations and deficits independently. So they don't need somebody to necessarily problem solve it for them. They're able to live and take on some of those higher cognitive tasks and thrive and do well. If for whatever reason you might need to remember the names of each one of these levels and you want to use this scale, I also have this handy little mnemonic here that you can use or improve upon. The way that this works is you have your 4 different groups. You've got your response group, which is 3 different levels. You've got your confused groups, which is again 3 different levels. You've got your automatic group, which is, I guess, 1 level. And then you've got your 4th group, which is the purposeful appropriate levels. So if you know those 4, then you can use the mnemonic "no generation long ago inappropriately applied automation purposefully," just to help you remember that there's the no response, the general response, the localized response, the confused agitated, confused inappropriate, non-agitated, confused appropriate, the automatic appropriate, and then your purposeful appropriate levels. So just in case that's helpful for you. All right, really important. I also want to go through key maybe things to think about when it comes to interventions or moving somebody along in the therapeutic recovery process per se. So levels 1 through 3, you can think about these as sensory STEM levels. So we're trying to increase a person's alertness level. So that would be really important in all 3 of these, because the more alert they can be, hopefully the more command following you can start to get, which will then get you higher and higher according to these levels. Also at this level, a lot of the things that you want to think about is maintaining range of motion, body positionings to prevent contractures. This would maybe include splinting. At level 4, you're limiting distractions in their environment to see if they can participate in those simple 1-step commands. And then what we're trying to do is manage those emotional mood swings. So trying to avoid anything that may trigger a swing, such as bright lights, loud music. By avoiding those things, you're allowing them to focus hopefully a little bit better, even if it's just for a few seconds. So at level 5, we are maintaining range of motion. Now they can obviously more actively engage in that. They can follow simple, like step-by-step types of commands. Now you can start to think some multi-step activities, but again, recognizing that they're going to need step-by-step instructions and redirection and support. In level 6, you're continuing your motor and cognitive interventions to maintain obviously and improve motor function. And then you're also using cognitive activities to try and help them improve their recall, making sure that we grade these activities according to their abilities. Focus is on simple familiar activities. You're thinking ADLs, IADLs, tasks that don't require them to remember a newly learned activity or task or component of a task. And you're focusing on trying to have them complete multi-steps as independently as possible to work on that short-term recall. Once they're at level 7 and they have better attention, they've got better recall, some new learning is happening, their social awareness is starting to emerge, and they're more oriented to where they are and who they are. Now we can focus on stepping up their ADL so that they can do that with setup, because now we want to start working on learning new skills or challenging like the higher executive functioning things a little bit, again grading it to their skill level. So ADLs they should be able to hopefully do with setup barring any other physical disabilities, to increase maybe their awareness, particularly of safety and social awareness, and to help with sequencing and completing multiple steps. Once we're seeing their attention improve and their short-term memory and their learning is becoming more efficient and effective, they're starting to move into level 8, where now we're starting to really consider pushing those executive functioning skills to even higher problem solving, higher levels of decision making and prioritizing and sequencing and recall. You're working on making them as independent as possible, thinking about what would it take for them to return to work, what type of environmental factors or task factors need to be modified in order to improve their level of independence. Now that they're really starting to hit their stride with, they've got hopefully their ADLs covered, they've got maybe even some IADLs covered. Now it's really about working on how do I adapt to a changing environment or a challenging environment, such as a work environment, a family responsibility environment where they're having to carry the load for taking care of a family, whatever some of those other roles are that the person has. And then that continues for level 9 and 10. Now, as we mentioned, irritability, low frustration tolerance, and depression are things that would be part of somebody in levels 8, 9, and 10. Occupational therapists are also uniquely equipped to help them with mindfulness techniques, cognitive behavioral therapy techniques, to help them maintain their level of function so that they can continue to live their occupational roles to their full ability. Don't forget to like, comment, and subscribe if you found this information valuable to you. On a quick side note, thank you so much for everybody who's been making topic suggestions and things that you really want to study and know more about. Understandably, I probably won't keep up with the pace of your study demands, but I'll do my best. So thank you. Continue to keep those coming, understanding that maybe I will get to it, maybe I won't. I definitely appreciate the interaction and knowing what's important to you guys. That being said, stay occupational, my friends, and I'll see you in the next video.